The title of this video is Unbox a Silver Bullet for Screening Colon Cancer. There are two parts in this video. First is for laymen, the second is for radiologists. Screening colon cancer involves doing tests looking for precursors of colon cancer and early cancers in asymptomatic persons. If present, treatment is given to prevent the development of invasive cancer. 50 years after the invention of the pap smear, cervical cancer is under control. 56 years after the advent of colonoscopy, colon cancer is still a menace. It is time to critically assess the deficiency of the procedure currently used for examining the colon. Procedure number 1, standard colonoscopy and variant. The incomplete rate of this is 5 to 25% in the US. The iatrogenic death rate is 1 per 1,000 examinations. Ann Baxter and co-workers combining data from Canada, US, and Germany found the miss rate of the cancer in the proximal colon is 40 to 67%. This is because cancer and precursors were missed 3 years earlier. Procedure number 2, CT colonography or CTC, X-ray was used. The miss rate of precursor is 10 to 12%. Two gastroenterologists alleged in Huffington Post, if this is used instead of colonoscopy to do screening, 150 cancers in 100,000 patients would be induced. Repeat calculation using their figures, the cancer induction rate is actually 0.25 per 1,000 examinations. Comparing the iatrogenic death rate of colonoscopy of 1 per 1,000 examination, CT colon is not so hazardous. Procedure number 3, single contrast barium enema. It is barium sulfate powder in water that is being used. Sometimes we just use the word barium. Polyps seen as bubble-like defects. The miss rate of polyps is rather high. Procedure number 4, double contrast barium enema. In Malmö, Sweden, the detection rate of polyp and cancer combined was 12.5%. The incidence at autopsy was also 12.5%. This is consistent with a miss rate of 0%. Unfortunately, in North America, cancer is occasionally missed. Number 5, sigmoidoscopy. Only the left half of the colon is examined. Number 6, capsule endoscopy. It may take up to 10 hours to complete the examination. Number 7, MR colonography. It is not readily available. Conclusion: the currently used tests and procedures will never be able to have colon cancer under significant control, not in the near future and not in the far future. This is where we are. I'm pleading for a silver bullet. As mentioned earlier, precursors of colon cancer are polyps of 1 centimeter or larger and are of the kind called adenoma. Cancer in polyps under 1 centimeter is very rare. There is a little known test. It can locate all polyps of 1 centimeter or larger. I repeat, locate all polyps of 1 centimeter or larger. Once located, there is no escape, because there are 3 methods of removal, even in the blind spot or in location of incomplete colonoscopies. Hence, This test has the quality of a silver bullet. This test is called fluoroscopic barium enema. It was devised by S. Tiffy and H. Carlson of the Mayo Clinic in Rochester. There are two special features in this test. The concentration of barium is lower than that of the standard single contrast barium enema. Feature number 2, they use a vigorous palpation, and that means forceful external manual compression of the colon. Result: all 29 polyps of 1 centimeter or larger were seen on barium enema. Thus, all precursors of colon cancer can be removed. This is a modification of the fluoroscopic barium enema. A modified name is used. The technique is also modified. Vigorous palpation is replaced with deep compression with a pneumatic compression pedal or a homemade compression device. Homemade compression cone. I went to a dollar store looking for a stick that's about 2 feet in length, and I also looked for a ball that is hard and light, and I found two so-called foam balls, and I bought them, and I cut one of them into halves, and I glued that onto the stick, and I also placed a metal ring to show where the cone is. The most important thing is I taped a metal bar of 1 centimeter in length at the apex of the cone. Here is a drawing of what's happening. This represents the colon filled with barium, and this represents the compression cone. X-ray is coming down, pressing on the colon. If there's a polyp, the polyp will show up, and the metal bar will also show up. If the X-ray comes down, if there's a polyp here but no compression, there will be no image of the polyp. Here is a real-life picture, and that's what I did. And you can see a 1 centimeter metal bar and a polyp, and that is 1 centimeter in the diameter, and also a smaller polyp. This is the ileocecal valve, and this is the cecum. The radiology compression pedal is here. You squeeze this bulb, and the bladder pops up to form a compression cone, and then you turn it around to compress the colon. For radiologists who are interested in this technique, please take a picture of this page and also the next page, because all the snacks have been removed except the low profit margin. This is the other page. All the technical details are in here. This is the end of the video. Thank you for watching.